Who here has or knows somebody with PTSD? Do you really understand what it is? About 7 to 8% of the population will have PTSD at some point in their lives. This percentage is even higher in our veterans. I think it is important for people to understand what PTSD is, the signs and symptoms, and treatment options, because someone you know may have it someday, and maybe you can recognize signs and symptoms and help them get the treatment they need. After listening to my speech, you will be able to explain what PTSD is, recognize the signs and symptoms, and list the treatment options. PTSD stands for post-traumatic stress disorder. It is a mental condition that can occur in people who have experienced or witnessed a traumatic event, such as war or combat, a car accident, rape, or other violent or terrifying experiences. There are 4 main categories of signs and symptoms. These signs and symptoms may appear within 1 month of the traumatic event, but may not appear until years later. The first category is intrusive memories. This includes flashbacks and nightmares. Often people with PTSD have flashbacks of the traumatic event, or they may wake up from nightmares screaming. The second category is avoidance. People with PTSD tend to avoid thinking or talking about the traumatic event. They also avoid places, activities, or people that remind them of the event. The third category is negative changes in thinking and mood. People with PTSD often have troubles remembering. They may have negative thoughts about themselves, others, or the world. They may have a hopeless feeling of the future, difficulty maintaining close relationships with family and friends, which causes them to have a detached feeling. They often have a lack of interest in people and activities that they used to enjoy. They may feel numb and have suicidal thoughts. The fourth category is changes in physical and emotional reactions. People with PTSD often are easily startled or frightened. They're always on guard and may resort to self-destructive behavior such as drinking, drug use, driving too fast, or other risky behaviors. They often also have trouble sleeping, which can lead to insomnia. They also have trouble concentrating and may become irritable, have angry outbursts, or aggressive behavior. They also may have an overwhelming feeling of guilt or shame. There are 2 types of treatments that have been shown to be effective for treating PTSD. These include counseling and medications. Counseling helps people understand their thoughts and reactions and help them cope with learn techniques to cope with challenging situations. Doctors often prescribe medications that can be used to help reduce tension, irritability, or to improve sleep. Often, these 2 treatments are used together. To summarize, PTSD is a mental health condition that can affect anyone at any time in their lives. The 4 main categories of signs and symptoms of PTSD are intrusive memories, avoidance, negative changes in thoughts and mood, and changes in physical and emotional reactions. The 2 types of treatments are counseling and medication, which are often used together. I hope if you or anyone you know are showing signs of PTSD, you are not afraid to seek the treatment you need.